Taoiseach, the problem with lockdowns is that we don't know which bits work and which bits don't. While they do contain the spread of virus, they also impose huge costs on communities, on business and, most importantly, on individuals. The costs imposed by the recent move to level 5, a huge increase in unemployment, a removal of social outlets for most of us, and the possible permanent closure of many businesses were insisted upon by the National Public Health Emergency Team. Each and every one of these measures are having a direct impact on the mental health of every person in this country, and we as TDs are all seeing this in our dealings with the public. Based on the COVID-19 wave model research developed by Dr. Philip Hovell and his team in UCC and presented to the HSE last June, we will have entered our third wave of infection by February next if we don't have the systems in place. And we could be facing, as a result of that, a further lockdown on Valentine's Day and our fourth lockdown over the June bank holiday weekend. Taoiseach, this situation is stark, and the only way to avert this is to, firstly, do what we failed to do last summer and put in place a proper COVID-19 system with the capacity and capability to test, trace, isolate and investigate the sources of infection. Taoiseach, the public will not accept another excuse from the HSE next February that the surge in infection could not have been predicted and that it was overwhelmed by the number of positive cases. The HSE has got fair warning and it has to get it right. Neither will the public accept an excuse from government that this is an operational matter for the HSE. Secondly, there is an urgent need to use Irish-specific data in relation to coronavirus trends and patterns to redesign the type of restrictions that should be imposed here to manage and control this virus. As Dr. Paddy Mallon pointed out, we are collecting huge amounts of data from contact tracing, laboratories, hospitalisations and digital data. And if the academics and government health experts work together to analyse it, we could find a way that would enable our people to live safely alongside the virus, rather than just surviving from lockdown to lockdown. Research into Irish COVID patterns could lead to informed controls, rather than policies that we have at the moment, which are quite blunt. We have a unique Irish circumstances here. There's a big difference between dispersed rural populations, which make up 37% of our country, and tightly knit urban communities. There needs to be a concerted effort into analysing the data we now have available to us in the hope of preventing the need for any further lockdowns in the future. Taoiseach, will you commit this government to act immediately and prioritise such research to help us all find solutions?
Thank you, Deputy.
I thank the Deputy for his constructive raising of this issue and the questions that he has asked, and to say that I fully accept the broad thesis of what you were saying in terms of the need for Irish-specific research, and I read the article that you referenced there by Paddy Mallon, I think it was in the Sunday Independent on Sunday, in relation to need to do a bit more work in terms of the specific data emanating from Irish sources. That work is underway within my department currently, in terms of doing more detailed statistical analysis of a whole range of variables around the virus itself. And I also would say to you that we're learning all along the way here. This lockdown is not the same as the first lockdown. Schools are open. We pay tribute to all involved in the school communities for the work they are doing, and we will continue to work with the school communities to keep our schools opening in the best interest of our children and our students, that they don't become a long-term victim of this virus. Construction sector is open. Given the necessity from a social perspective that we continue to build homes, to deal with homelessness, to deal with the needs of people who need affordable housing and social housing, long waiting lists. The first lockdown had a big impact on construction and resulted in the country not being able, now won't be in a position to fulfil its targets that it had at the beginning of the year on the housing front. So again, what we want to do now is get the figures really down low. And I think we should retain a real collective national effort to get the figures down. That gives us more flexibility at the end of November to see how we manage the months after the end of November. And again, learning the lessons and using the research to, as a country and as a people, adjust our behaviours consistent with trying to keep the economy open as long as we possibly can and protecting livelihoods, but above all protecting public health. And in terms of the testing situation, the ECDC, the European Centre for Disease Control, shows Ireland as among the highest ranked countries in Europe for processing high volumes of tests. It's about 120,000 is the capacity now per week. Over 112,000 were swabbed last week. And to date, over 1.4 million tests have been carried out in labs across Ireland. In terms of test and trace systems, we do need, and we are recruiting very actively now in terms of both the contact tracing. There's about 650 now working in contact tracing centres across the country. 344 of those are new recruits. The rest are redeployed staff. There's 450 more will be recruited so that there will be a dedicated, separate task force or workforce of about 800 in contact tracing centres. There are currently more than 1,000 working in swabbing at the moment. And again, that is made up of redeployments and new staff. And there's continued new recruitment in terms of those for swabbing purposes. 650 million has been allocated for testing and tracing next year. It's no small sum of money, 650 million, but it's vital in terms of our battle against the coronavirus.
Thank you, Deputy.
Taoiseach, we need to use Irish data to inform Irish decisions and not continuing to rely on NPHET advice, which is based on what the EU health authorities are saying. Managing the virus in France and in Germany is very different than on a rural island in Western Europe. So the tools used by EU colleagues to tackle the virus may also be very different to the tools that will be used here that could allow our economy to survive and, more importantly, our people to live. The World Health Organization has made it clear that a strategy of rolling lockdowns is not recommended, and we need to take this on board. We need public buy-in to whatever measures we take in this country to battle against COVID-19, and there is a genuine concern that the lockdown fatigue is beginning to set in. Taoiseach, would you agree with me that we need to take the time now to analyse the data and find an Irish solution that fits with our unique circumstances and avoids the need to repeat of future Level 5 restrictions?
Thank you again. Look, I accept, first of all, your point about the need for research and ongoing research to inform future actions. That I accept. In terms of the tools in Europe and what they're doing in Europe, in many ways we've been ahead of what many European countries have been doing in respect of dealing with the second wave. And in fact, I found that when I was meeting EU heads of state and other prime ministers, that what they were calling lockdown was our level 3. Which is essentially the closure of hospitality. And some are just about doing that right now, whereas about 4 or 5 weeks ago we were dealing with that in terms of the hospitality sector. And the hospitality sector, aviation and travel has been the hardest hit in terms of the people involved in that industry, employment and so on. So I am conscious of that. But equally I think there are no magic solutions to this. The basics stay the same. I was reminded by someone recently when they looked at certain advertisements for the 1918 flu. And they were quite similar to the basic advice that's being given to people today in 2020 in relation to this pandemic, in terms of social distancing, in terms of avoid congregation, and in terms of etiquette, cough etiquette, sneeze etiquette. It is about human behaviour, fundamentally, in terms of the prevention of this virus. Our geographic location is a bit more problematic than New Zealand, to put it that way, in terms of stopping the spread of a virus. We have a border, we have a very close relationship with the UK in terms of travel, and Europe as well. And that is problematic as well in terms of containing and having the zero COVID approach, which I would think would be very difficult indeed.